Chris, thank you so much. I particularly want to thank the students that are here. 40 years ago, I was a senior. And this is a very difficult time of the year, waiting to find out where you'd be going next. I was a little bit of a gawky kid, and I had no idea what life had in store for me. And it really is, if there's one message you take home, it is the adventure of life. But I'm very grateful for the school here for helping me. I don't know if I would say, they didn't prepare me for the details, but they definitely prepared me for the big picture. And if you want to get a better feel for that, let me give one example. My roommate when I was here is sitting right there, Peter Farrell. So he knows what I was like 40 years ago. And I'm really grateful to all the faculty, some of which are here, and to the school, and to the monastery for who they are. And Chris, thanks for that wonderful introduction. So I'm going to talk about Ebola and going to Liberia. I always start these talks with a picture as well down in the corner of the virus, because this, of course, defines the epidemic. This is a nasty, really terrible virus, which, when it replicates at very high levels, causes horrendous illness. Worse illness than almost any other viral illness that we know of. And once it gets within humans, and you see people getting terribly ill, that amplifies the epidemic. And that really defines the epidemiology and the spread, and that is what helped us to try and figure out how to respond. I'm going to tell you a bunch of stories, I'm going to show you what I did, and I'm going to throw in some biology and some epidemiology to see if it'll pull together. And for the students, feel free to leave when you need to leave, and I'll give you one piece of advice for you. In life, oftentimes we wonder, should I go to a talk? I'm going to show up late. That's going to be difficult and hard. Or I'm going to have to leave early. My one piece of advice is, even if you have to show up late, even if you have to leave early, always go. Okay. Now, this is a slide of Africa, of course. And what you see is this brown circle is West Africa. That's where Guinea, Sierra Leone, and Liberia are. And in fact, right in that corner is where this epidemic began in December in a young child that became infected in a very rural area. The borders here are very porous, and people travel. They have families, clans, tribes. They go back and forth. And most of the vegetables, in fact, that are sold in Monrovia are grown in this part of Liberia, right near Guinea, or in Guinea, and go down to Monrovia right there. So there's lots of traffic back and forth. Now, this is Central Africa, DRC, Democratic Republic of Congo, used to be called Zaire, and this is where most of Ebola Zaire has occurred. Both, you can see right here, Congo, DRC, and there have been over 23 epidemics of Ebola. The first one was in the Yumbuku Mission Hospital, a Catholic hospital, which was devastating and terrible. A whole group of nuns became infected and died, but it was pretty much contained because the epidemic occurred in rural areas, and it was relatively easy for the communities affected to be isolated. And because of that, all of the previous epidemics, most of them had 50, 75, 100, 150, maybe 200 people infected. But all of the prior epidemics combined had less than 2,000 people infected. So when this epidemic exploded in West Africa and just continued to take off, everyone was caught totally by surprise. This is truly new. Today, there are almost 18,000 people that have become infected. When I went over, it was about 2,000. Nobody had any experience with an epidemic on this scale, and it was an epidemic that had penetrated into densely populated urban areas, and that was totally new. And that's why the challenge was so great. So, this slide shows the epidemic from about March over till this time. This is August 31st when I flew over. So, pretending around this time, this is July. I was reading about Ebola. Clearly things were getting out of control. Beginning of August, I wrote to Catholic Relief Services, Caritas, a few other places, and Father Bob Attilo, who I'll show you a picture of, said, you got to contact Sister Barbara. I said, Sister Barbara, who's that? Oh, he said, that's a Franciscan missionary Mary, and she spent 37 years in Liberia, including being there through the 14 years of the civil wars. And she started the School of Health Sciences. She happened to be in Maine at the time for 3 weeks for her, every 3 years. She took a family vacation, and she was about to fly back. So I sent her my CV, and she said, yeah, I think you could help. I said, what do you think I'm going to do? She said, we'll find out when you get there. Okay? But we were going to leave the first week in September, and she said, we got to leave earlier. Delta is canceling all of its flights. The last flight's in August, and that means August 31st is the last flight in. That's the flight we got to get on. So this is when we left. And you can see this line, the top line, is the cumulative cases of Ebola in the country of Liberia. The bottom line here is Guinea, which is where it started. And you can see Guinea just kind of chugged along. And then this dashed line here is Sierra Leone. But you can see in Liberia, in July and August, you see the sharp inflection where the cumulative cases start to rise rapidly. And this is when the epidemic was really taking off. Importantly, there's a little black line here, which is Senegal, which is extraordinary, and Nigeria is in here as well. There's terrible news with this epidemic, with awful suffering and the death, but there are also great successes. And Senegal and Nigeria, Ebola entered, there was transmission, but they were able to stop it, and both countries are now Ebola-free. So this is when we arrived there. Now, a little bit of background. We think Ebola spills over. It's present within bats, it goes to other mammals, and then once it gets in humans, you get person-to-person transmission, which really amplifies it. You say, bats? How can bats get a viral infection? Well, another viral infection we're all familiar with, which is worse than Ebola, is rabies. 100% fatality. And rabies, bats carry rabies, and then animals can get it, and of course humans can get it. But with Ebola, once people get infected, it amplifies it, and the spread can occur so rapidly. But it only occurs when you're sick. Very important. But when you are very sick, and unfortunately if you die, the level of virus in your body is sky high. I mean, really extraordinarily high. So all your body fluids then are infectious. So blood, diarrhea, vomiting, sweat can all be infected. Now, this means that transmission occurs in the hospitals and the healthcare centers and in the households. Not generalized, but in these very specific areas. This was by far and away the largest outbreak ever. West Africa had never seen it. So people initially said, what is this? Are we being poisoned? Has this been introduced? Is someone trying to kill us? And people say, well, how could that have happened? Remember, this is a part of the world that suffered 15 years of awful civil war. And there's a lot of corruption and exploitation. So it's not like, you trust everybody. There's a lot of distrust, and that distrust is natural. So suddenly when this epidemic came, people didn't know how to respond or where to turn. The other thing is that the healthcare system is terribly weak, so that most of the clinics didn't even have a good supply of disposable gloves. And the number of healthcare workers is very, 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 very low. I mean, at one point, they were saying there were 7 dentists in the entire country, 1 psychiatrist. I mean, the healthcare system was very, very weak. And this really contributed to the escalation of the epidemic. Finally, the last thing is fear. And we'll mention this at the end. Fear is very basic. It's deep in our heart. And this is individual fear and institutional fear. And what do I mean by that? Individual fears, we all know what that feels like. 2 o'clock in the morning, what am I going to do? Institutional fear means, what do we do? We better get out of here, because we don't know how to handle it. So, in fact, Catholic Relief Services, who has been working in Liberia for 20, 30 years, including through all the Civil War, which was very dangerous, in July they pulled their people out. Because they said, we don't know what's going to happen. They did send them back in, and they played a wonderful role. But the institutional fear is huge. So that groups and institutions that are used to responding didn't know how to respond. So this is the group of sisters that I joined, and they really took me in and made me part of their work. They're the Franciscan Missionaries of Mary. This is Sister Tava, who's from Sri Lanka, Sister Annie from Liberia, Sister Janet from Ghana. This is Sister Barbara Brilliant, originally from Maine, Sister Fatima, who's from Chennai, India, and Sister Evie, who's from Boston. And they were a really tough, wonderful group. They had a school there, their convent, and a school of health sciences, which was remarkable. I was living in a guest house right next to a church, and I went over and they asked me to speak after all the masses on Ebola and give a homily one of the Sundays. I don't think they asked me after that, but we'll talk about that. And then the very first thing we did was teach and train. So we teach, train, assessments. The very first week we went out to all the healthcare clinics and the health centers, which I'll talk about. How were they providing care? What were they doing to stay safe? And what did they need? But in all of our trainings, I was working with faculty from the school, and they were unbelievable. Mostly nursing faculty. And of course, the center of healthcare is always nursing. That's the most important point. But we also worked with a number of individuals that had recovered from Ebola. And this is a very important gentleman right here, Dr. Senga Omienga, who is a surgeon from DRC in Congo, working at Catholic Hospital. And we'll talk about Catholic Hospital, which sustained a terrible outbreak of Ebola. 15 cases, of which 9 people died. He recovered, and he was part of all of our teaching. And it was extraordinarily powerful for him and the colleagues of his that recovered to be teaching about Ebola, about how to stay safe, and how to recognize it. It was really very, very important. Not to mention that if you recovered, you're immune. So that was an important component. Okay, so we started out, we brought over 10 hockey bags full of equipment. And the donations of Rhode Islanders was incredible. From the parish, from everyone around, from a number of you all, so generous. Anyway, we brought over 10 hockey bags. I called Sister Barbara the day before and said, Sister Barbara, we're filling up these bags. Delta's not going to let us take these bags. She said, don't you worry. I've already contacted them. These are humanitarian supplies, and they're going to let us take them. And they did, free of charge. So I said, this is pretty good. So we went over, this is Tyvek suits, which you actually can buy at Home Depot. They're not perfect for this because it's easy to contaminate yourself while taking them off. This is one of our initial trainings. I'm the tall guy right there. Everybody was screened in general life there, in general activity, screened with these little temperature guns. One right here. This is a training we did right here. And everybody was screened for fever. And if you had a fever, obviously there's concern, could you be infected? You could not be out in the general community. We also didn't touch each other. No touch. Really odd to go through day after day after day after day. No handshaking, no hugging, no kiss on the cheek, nada. And somebody says, well, wait a second, why are you doing that? You just told me that Ebola is not spread if you're healthy, and that is correct. You don't get Ebola if you're healthy, you don't transmit it. Even if I got infected yesterday, and I'm not going to get ill till 5 days from now, today I won't spread it. You won't find it in my blood. It was at such a low level. But the reason it's so important is, if you're at a time of Ebola and you get flu or another infection and a fever, that's a disaster. So it was a very, very good policy, and people really adhered to it. It was quite remarkable. Now, we went to these different health centers and clinics. This is Star of the Sea. This is in West Point, a slum area of 50,000 people, the only place to get health care in that area. They stayed open through the entire epidemic. I thought when I went over this was going to be a health clinic, like one that we have here in Rhode Island. That means they're open at 8 in the morning, and maybe they close at 5, or if they have evening hours, they'll close at 7 p.m. No. You can spend 3 or 4 nights there if you need to. You can get a C-section if you're pregnant and things are not going well and you need it. You can get minor surgery. These are kind of mini hospitals, and they are critical for the health care. This is another one, Sister Agnes, a big maternity center, named after one of 5 nuns that were killed during the Civil War. Outside every clinic and health center, outside most homes and most businesses, was this, a container of bleach water. This is Clorox diluted, either 10% to clean up body fluids, or 100-fold, dilute 100-fold in order to wash your hands. And this was highly effective and made all the difference in the world. Different dilutions of bleach. And this was widely available and really helped the community to respond. This is one of our assessments, Mr. Bean and Mr. Brown. This is the OIC, the officer in charge. She would tour you around the clinic where we'd say, now, where do patients come in? Do you triage? Are you screening them for fever? Where do you isolate them if they don't look well? Because this is how the health centers and clinics stayed safe. And then we'd say, how can we do a training where we don't close you down for the day? So all our trainings were from 2 in the afternoon till 5, because most of the care was provided first thing in the morning. And then we'd say, show us the supplies you have. Let's see. And that type of communication, working with them, was really important. We shadowed the nurses and the physician's assistants initially to see how it was going. Some of the health clinics were off the radar screen. These are private clinics that were unregistered, nobody even knew about them. The registrar's office, the delivery rooms, you can see these are really mom and pop operations, which was scary, because this is where you could get Ebola being transmitted. And so we did trainings in these areas as well, which was really great. Now, this is a woman who just delivered at Star of the Sea. When I first went over, I thought it's all about PPE, personal protective equipment. That means gloves and gowns and masks. But what I found out quickly is that's not what it's really all about. That's part of it, but it's also about triage. Recognize somebody who's infected right when they step in the door and get them isolated. You've got to use this bleach water everywhere, not just at the entrance to the clinic, but it's got to be outside the evaluation rooms. It's got to be available in the isolation areas. So it's got to be used continuously all the time. And by the way, you've got to change it every day. Really important. So it's about infection prevention and control, which is not a one-time teaching, it's a process. And that means getting to know the clinics, getting to know the officers in charge, and working with them week by week, which was really a wonderful experience, because these folks were going to work every day knowing they could become infected. They really were brave, and they were anxious and worried, but they kept going to work and kept keeping their health centers and clinics open, which was remarkable. This is a rack where disposable gloves were being washed and dried. These are obviously, cleaning gloves, but these are midwife gloves that are supposed to be used one time. But they were routinely reused because supplies were so short. Now, this is one of the warehouses. Sister Barbara, I said, well, how are you going to get donations, and how are you going to distribute them? Oh, she says, I'm an expert at getting containers through the port. And by the way, we have 3 warehouses, and it was true. So right here, these are sprayers where you would put concentrated bleach water to clean up body fluids to make sure you could decontaminate it. These are boots that were bought on the local market. These were donated goods. This is a German doctor that came and helped Dr. Clemens. So it was about protective equipment. It was about the bleach water. It was about triage and isolation. And this was really a process. This is the algorithm used by the Ministry of Health, where you deal with contact with patients, then do they have a fever, and then do they have symptoms. And are they a probable, a suspect, or not a probable case? So this was what we practiced and taught and went through with the staff. And this was going on, at the same time that my colleagues in the U.S. were preparing here, because this was the time when the outbreaks, when the case was coming through in Texas, September and October. Now, I also worked at St. Joseph's Catholic Hospital, unbelievable hospital, great healthcare facility. They've been there for 50 years, run by the Brothers of St. John of God. This is one of their posters right here, a Spanish order. This is the entrance. This is maternity ward. This is Dr. Senga, who was here before. This is Father Bob, who introduced me to Sister Barbara and was over for about a week. This is Roberto, who's from Spain. And this is the entrance to the casualty. Unfortunately, way back in July, a woman from Sierra Leone came. Her brother, Patrick Sawyer, was a politician, and he carried her into the hospital. She had been refused admission at 2 other places. They admitted her, and the head of the hospital, Brother Patrick, spoke French. So he helped take care of her. He was also trained as a nurse, and he became infected during that time. Then she died. He then got ill, and everybody suspected Ebola. but the first Ebola test was negative. And we now know that the Ebola test can be negative in the first 3 days, but at that time, that was not appreciated. So when the Ebola test was negative, a whole bunch of other doctors and nurses got involved, trying to figure out what it was. They were about to send him to Ghana to get help, because he was doing worse and worse and worse, and a repeat Ebola test was positive. As I say, 15 people became infected, and they had to shut the hospital down. So we ended up really helping with a whole series of trainings at Catholic Hospital, working towards getting it reopened. And that was done with partnership as well with the Red Cross that were phenomenal. So this is an example of the training, so it's not at Catholic Hospital. This is with the midwives, and they have to wear advanced PPE because there's so much exposure to body fluids. And here they've gone through the training, the practice, and this is a picture of everybody obviously having a little fun. This is one of the lectures that I'm giving, really quite wonderful. And the first training we did was the first time the 150 staff members had gotten together since the outbreak had occurred. So that was a lot of questions and wondering and discussion and really healing. And then this is right here a physician assistant. She became infected with Ebola. She got an experimental therapy, ZMapp, one of the 3 Liberians to get it. She was on the point of dying. It's what we call in medicine obtunded. She was not responding. After a second dose of ZMapp, she was sitting up and doing remarkably well. So will this end up being phenomenal treatment? We'll see. It's being evaluated right now. But as she was recovering, after she started to get better, she had to stay in the Ebola treatment unit because you had to stay there until your blood test was negative. You wouldn't be discharged until your blood test was negative, because that meant you could go back home and you would not be infectious, even though there was a lot of stigma and difficulty. But still, while she was better, she went around and took care of everyone in the Ebola treatment unit, including a lot of the people that were recovering from Catholic Hospital. And this story was so moving and so emotional that at the end of the training, everyone wanted to take their picture with her. And that's what's going on right here. Very, very moving. So while you're doing this training, general life goes on. You know, there's people this is a market, just a little stall on the way on one of the roads to West Point. These little bags are filled with bleach. They're being sold just a little bit, for as cheap as you can imagine. And this is just, an apron right here. These 3 girls are going off, walking to the market, probably enjoying their grandmother with, their mom said, bring this to her and get going. And quite remarkable. So life is going on. You can see the commerce, the markets. So Ebola is not being spread in the general setting. It's really in the hospitals and in the families. Now, while we were doing this, every week we'd have different updates with WHO. And this slide tells a story from a talk given by the medical officer in LOFA. LOFA right here was accounting up where the epidemic started. And in blue, you see probable cases. This is day by day. And in red, you see confirmed cases of Ebola. And this shows how dynamic this epidemic is and how it can increase so quickly and then decrease. So you look down here in April, May, June, and July. The epidemic's kind of chugging along, and suddenly it escalates dramatically. And this happens relatively quickly, over a 2-week period of time. And the other side of the coin is it can be controlled in this area. This next slide shows the daily admissions. These are daily admissions, daily total admissions to the Ebola treatment unit. And this shows the impact you can have in the community. So in July, they were getting 10 to 20 admissions a day. All of a sudden, in August, 120 admissions a day. They had to expand their Ebola treatment tenfold. They couldn't do this in Monrovia, in the capital. That's why you saw the pictures of people lying outside the Ebola treatment units trying to get in, and how awful that was. In LOFA, they did expand, and the rates did go up this dramatically, but then they started to come down. And by the beginning of October, you see this incredible decrease. And this gave us hope. It can increase that quickly, but it can decrease this quickly. So the question is, why? Why does it increase? And then how do you get it under control? So the initial phase, when it really explodes, a lot of it is driven by fear, denial, panic. People run, they hide. They don't send people that are sick to the treatment units. They hide their dead because they don't want the government to come and bury them, because they don't trust them. And that's a disaster. Because in Liberia, you wash the body of the person who you love who's died, you dress them. The funeral is very emotional, you're all there. It's a chance to say goodbye. You'll hug that person. And that's not that uncommon in many parts of the world, and it really can be a very beautiful thing, because you're showing your respect and love. But in the case of Ebola, it's a total disaster. And there was not the leadership, there wasn't the community organization, there wasn't the information, and there wasn't the engagement of the community in order to respond to prevent this from happening. And the epidemic really spread rapidly during that time period. Now, when it does spread that quickly, you've got to have Ebola treatment units to take care of people that are sick. And this is an example of one. I did not work in these treatment units. I worked in the general health sector. I went up one Sunday to Bonn with Dr. John Lee, another Brown grad, and Dr. Adam Levine, who was working there, who's a Brown physician who's talked a lot and written a lot about what it was like. And he helped set up this Ebola treatment unit, which was really, they did a phenomenal job. But when you think about it, you think, wow, they just built a hospital? They do build these hospitals, but they're made of tarp. These are really these are temporary structures. We're putting them in place. We hope a year from now, we'll take them down and they'll be done. So these are really there for isolation and care just for Ebola. And this is what it looks like. The key, though, was the community response. And when the community responds, that's when you see the decrease. And this gives an example of that. This is a typical poster that's all around, telling people, Ebola will kill you. This is how it's spread. This is how it can be prevented. Awareness is critical. This was a group organized by the Salesians. They called themselves the Don Bosco Health Animators. And I think we should have in Portsmouth Abbey a group of animators. And they wrote their own song. They had incredible harmony. And they would sing to different groups and then talk about Ebola and how it's spread and how you can prevent it. This is a group right here of HIV-infected individuals that were well, that were community educators. And we did a training session with them, and they quickly said, wow, we're not going to be HIV educators, we're going to be Ebola educators. And they went out to really work with their community. Now, every week when I was there, I was on the radio. This was new for me, Radio Veritas. And we would invite different people, and this is Dr. Fanta right here. She had recovered from Ebola. She almost died. Really a very moving story. And she told her story on the radio, which was very courageous. Because when she recovered and she went back to her apartment, the other folks in the apartment kind of compound said, we don't want you here. Forget it. Fortunately, she was with a friend, and the friend said, come on, we're just going in anyway. And they did, and over the next few days, everybody saw, well, obviously she's healthy. So they got over it. But the stigma and the fear, even among people that recovered, was terrible, really terrible. So this is another group of community educators that's organized by Sister Tava, and you can see how animated they were. And Dr. Fanta joined them all the time to speak because of how powerful her testimony was. But they would go out and they would talk to people. Use the bleach water. Recognize if somebody's infected. If they're sick, you've got to go to an Ebola treatment unit. If you've been exposed, you've got to stay home for 21 days and make sure you don't get sick. That's how you break the cycle of infection. And they did a phenomenal job. I mean, they were really incredible. So this is an example of a training we did out in Dolo Town near Firestone, which is a big area where they collect latex from the trees. And these are community educators. And this was a young girl who also had recovered from Ebola. And she came and joined us just that day to talk. But this is Sister Maria, who lived in this area, who's now got a big program taking care of children and orphans and kids who have had family members that have died and very weak families, vulnerable families. But this group went through a day training, and then they went out community by community by community to work with the communities in order to really engage and mobilize. And this had a huge impact. But it was very moving for me because, when we arrived and during the break, we walked around and to hear the stories of how Ebola had really struck that community hard was very, very moving. But there are a lot of challenges. This just gives you a feel. Every single health center and clinic I worked at used a hand pump for water right here. This is a hand pump right here. A lot of them had these tanks. This tank is there for running water because if you've got a pump and piping, you can pump the water into this tank and then it'll flow out. All of them had been working since the Civil War ended 10 years ago. So none of the clinics had running water. There was a great clinic we visited, Benedict Beanie. Incredible, did a great job. But this was the road to the clinic right here. So the regular ambulances couldn't get to the clinic. You need a four-wheel drive truck to get there. What a barrier. And this is just sort of a scene from day-to-day life. Folks all crowded together, waste management, forget it. It's a totally different deal. So the challenges were sobering. And things that you think would work easily here, they will not work so easily there. The key really is partnership. Here I am with Dr. Senga. I brought along an extra pair of glasses, and he's a surgeon. And as a surgeon, he said, oh, those are key for me. Because when he operates, you can't drop your glasses. That's a key move. So he was pretty excited about that. And this is a group of the sisters. And this sister was working up country where they had a clinic, and she came down to get supplies. So containers came in every 2 to 3 weeks. They went to the warehouses, they got sorted out, and then it got distributed right away throughout the country. But that's hard to do. And the Catholic Church was amazing because of the parishes, the clinics, the trust. This is a network that worked, that's close to the people. And that is so invaluable. It really was remarkable to see this whole network work. The goods, the money got where it needed to go. This is our healthcare team. Actually, one of 4 healthcare teams that we worked with from Mother Patern. Josephina here was one of the best teachers I've ever worked with. When she got up, she was animated. Her Liberian English was incredible. And the way she talked, you listened. It was really extraordinary. But these folks went out up country, and they worked in clinics throughout, really in remote areas in order to get the word out and to conduct their trainings. That was really phenomenal. Now, this down here, this is a group of midwives from Catholic Hospital before we opened. We went to another hospital, Elwa. Elwa was in the news quite a lot. And we asked their midwives to help give a training for our midwives before we reopened the hospital. And they said, we're going to put on a skit. And they did. And this is their midwives. One of them is acting as a patient, telling kind of a wild story. They come in, they deny they're exposed to Ebola because the denial was huge. And telling the nurses, here's how you got to deal with it. These are the questions you got to ask. Don't accept that answer. Try again. It was really something to see. So that was them. And then this is interesting. This is a building called the CCC, a Community Care Center, but it's really an isolation building. But we, meaning all of us, got involved in constructing different rooms and different incinerators, things that you never think about. This is a room being built right here. This was a window. They busted right through the window and made a door. And this is now a new room, which is going to be used to take off the protective gear safely. You need a safe place where somebody observes you taking off your protective gear and will spray you down with bleach water if there's any body contamination. And that's being constructed right here. And Dr. Senga, the fellow whose picture I showed you, he was the physician who had recovered. He's directing this unit right now. And that's doubly good because he knows about Ebola and also he's recovered, so he's immune. He'll still wear the protective equipment, but he has an extra layer of protection, which is very helpful. This is the vicar of the Archdiocese in Monrovia, Father Charles Boyce, a great guy. And one day we were walking around talking about these challenges, and he said, we have a saying in Liberia, when God gives you a big load, he'll strengthen your neck. And the resiliency of the people was remarkable. And they really are the ones that get the credit for the incredible response, which I'll show you right now in Liberia, where the epidemic there is under much better control. Now, we worked with a couple of groups that help take care of children. This is Cenacolo, and this group is originally from Italy, and they have a community in Liberia, and they took care of vulnerable children, orphans, foster kids, but we helped them as well, thinking, how do you protect yourself from Ebola, sorry. And this is the Liberian Mission, a group founded by lay Franciscans, and they had a boarding school out there. So we went and visited them and worked with them, helping them with some of their challenges, too. So this was a little outside the regular healthcare system. Okay, so what is going on today in Liberia? This is from the WHO Situation Report. This right here, this is July, this is September, and this is November. And what you see here are the number of cases, both probable and suspect cases, weekly. And what's remarkable is there's been an 80% decrease in new infections in Liberia. So Liberia is doing so much better. And that's really due to the community mobilization and the engagement, as well as the extraordinary help from so many different groups. So, what has contributed to this success? Community engagement, local leaders really getting out there and spearheading this message. The women groups and youth groups were really very, very effective. Every Mass, every Protestant service, every Muslim service, the imams, the ministers, the priests worked together beautifully in West Africa. They all talked about Ebola weekly. It was remarkable. Having the Ebola treatment units in place was critical, and that ramped up while the time I was there. In September, there weren't enough. It was a disaster. But by the time the end of October came, the help was there on the ground and made all the difference. And some of the help was USAID, was our Department of Defense. Doctors Without Borders was extraordinary. The Red Cross, a lot of help, which really made a big difference. They were able to get out into the community, and they were able to diagnose Ebola with PCR. Really critical to have the diagnostic capability and do the active case finding. And then getting the regular healthcare system open and really engaging people, including people that had become infected, survivors, and getting them out there speaking. And this was key for both stigma and for fear. Now this shows you where we are today. This is the WHO map from the beginning of December. And this is Liberia right here. This is Sierra Leone, and this is Guinea. And the yellow dots represent the amount of Ebola in the last 21 days. That's key. The shades of blue represent cumulative cases. So I was right here in Monrovia, okay? And it's dark blue. There have been a lot of cumulative cases. Still pretty big yellow dot. That means a lot of cases in the last 21 days. But now look at Sierra Leone. Sierra Leone is really doing poorly. So we've seen an 80% decrease in Liberia, but not in Sierra Leone. Guinea, on the other hand, is very spotty. These white areas mean not a single case of Ebola. But yet, right here where the epidemic began, big yellow dot. Lofa, the area I showed you where they had great success, right here. No cases in the last 21 days. Incredible. And you can be sure that this border zone right here, people in the communities in Lofa, bordering on Guinea, they're definitely on the lookout for any new cases because the community has mobilized. Now this unfortunately is Sierra Leone. This goes right to December, and the cases, this is cumulative cases, increase, increase, increase. Really a difficult situation, which means things in West Africa are not under control. And with Ebola, one case is a disaster. One case can go to 10 cases, can go to 100 cases within 2 weeks easily. So getting a 90% decrease is not enough. You really need to go for elimination, which is a big challenge. And this is Guinea. Guinea, unfortunately, the cases are many fewer than in Sierra Leone or Liberia, but the epidemic keeps chugging along, and we have not seen a decrease. So we still have a lot of work that needs to be done. So this is the total numbers again in December, and it used to be Liberia was overwhelmingly had the vast burden of disease. But now, 7,700 cases in Liberia. There are more now in Sierra Leone. So you can see we've still got a long ways to go. And this is the last 21 days here. Only 200 cases in Liberia, 1,300 in Sierra Leone. A lot of work still needs to be done. Now, there is hope on the horizon. And a lot of the hopes can be with technologies. We're going to get a new treatment. So this is ZMapp. And there is transfusion of blood or plasma from recovered individuals that have antibody and have a good immune response to help people that are sick. So the ZMapp that I mentioned with that one physician's assistant, it appears to work in a few cases, but now it's got to be ramped up and really evaluated. Blood transfusion and plasma has been used, and by individual cases, looks like it can help. There are going to be new rapid tests. They're not online yet, but you're going to be able to do a finger stick and know whether you might have Ebola within 10 minutes. That will help enormously. The French have a test that they've been evaluating in Guinea. And finally, vaccines. The vaccines that are out there are great in animal models. They're just now being evaluated in humans. They're going to come online with big trials in the first half of 2015. And really, elimination might end up needing to wait until the vaccines really produce in a big way. It is so sad that we waited so long. In March, the head of GlaxoSmithKline called the head of the WHO, said, hey, we got a great vaccine, but if we need to evaluate it, we got to start production now. Can you help us? What he's asking for is $10 million from WHO. WHO said, well, WHO does not have money hanging around. So WHO said, well, we don't really know. Let's see what happens. We'll get back to you. Nobody did anything until July and August. So they lost 4 or 5 months, which was really too bad. So I can thank all the people that were such a big help. This is the Franciscan Missionaries of Mary here. They were such a big help. This is Brother Bernard for at St. Joseph's Hospital. Brother St. John of God. This is the tree right outside the guest house where I spent a couple of weeks. This is me with the coconut juice, of course. And then, after I left, Father Bob, who was in the picture, who was with us for about a week, he was in Rome and he said, hey, we're trying to organize our response with Caritas. Will you help us? I said, absolutely. Great place to be. I want 21 days before I go home. So here I am. This is in Trastevere, and I'm right here. Father Bob is here. This is Father John Toy, who's a chameleon, who's also a physician assistant. And I met him in Saigon doing HIV work almost 10 years ago. And this is Dr. Clements, who is a German physician. So we were all there during one of their meetings. And I followed WHO recommendations. Monitor your health twice a day. If you get sick, you've got to go seek medical attention. But you don't need to be isolated because you don't have known exposure that was unprotected to somebody who could have been infected. So just a few thoughts to leave you with. Fear. Fear is real, it's deep in our hearts, and you have to respect it. You can't just treat it with contempt or say it's stupid. It is real, and this is a highly infectious agent. But by knowing how it's spread, by knowing exactly the routes of transmission, you can interface and make a difference and do it relatively safely. But you have to recognize that fear. Some of the people in the school there didn't want to go out to the clinics. We said, that's fine. You also have to recognize it yourself. There were times where it really was scary. And what I did, I think, was really quite safe. So I was not working in an Ebola treatment unit. But you still worry. And what do? You have to look after yourself, and you have to pray. Really important. And that particularly is the only answer sometimes at 2 o'clock in the morning when you just get yourself worked up. What does solidarity mean? We use the word solidarity a lot. When I went, I didn't really know what I was going to do. And I really have to say, Lord, you've got to help make this work. I think solidarity means when people or someone is in trouble, just go. And we face this all the time. Your cousin's daughter just dies in a car accident. You're like, well, maybe I should go. But if I go, what am I going to say? I don't know what to say. I'm scared of that. I'm scared of being there. Just go. Solidarity means go. You'll figure out, maybe you won't say anything. Maybe you'll say the wrong thing. It really doesn't matter. Solidarity means going. It doesn't mean fixing the problem, because you can't fix it. You might be able to help, and there are a lot of people helping here, which is great. But just go. And then there's this funny term, subsidiarity. What does that mean? It's a really important word. What it means is work with the people. Work at the most local level possible. And I was only able to do that because I was working with all these different folks that had lived there forever, that were part of the Catholic Church in different ways, and there were lots of other people that weren't part of the church that were in the same situation, of course. But it meant not working at the 100,000-foot level or the 10,000-foot level. It meant going, visiting the clinic side by side, hanging out with the nurses, and talking to all the other Liberians. What do you think we should do? You know, what's the best way to do this? And working with them side by side. It means working with the community and strengthening the community, always working at the most local level possible. Don't work with the higher-ups. Work at the local level. That is the only way to do it. And that, at the end of the day, will strengthen the situation and the community, as well as building true friendships. And that's where the joy of this type of work is. And finally, I have to thank the team at home. When I said, Luba, I'm thinking of going. Well, she said, well, what are you going to do? She said, let me see the emails, let me get a feel for this. And so she kept tracking the emails. I said, okay, this makes sense. So, don't do anything stupid. I'll hold down the fort, which meant, Nick was doing football and hockey, Pat was doing hockey and bagpipe lessons and her work and everything else. She said, I'll hold down the fort. Don't do anything stupid. And by the way, when you're done, don't come home. Spend 21 days somewhere else. Because you're going to screw everything up in Tiverton if you come home. Because I know you're not going to stay around at home. You're going to want to go out and have a beer with your buddies and go to the Coastal Roasters coffee shop, and that is not okay. I said, okay, I said, that really doesn't make sense. She said, yeah, that's the problem. That's what you think doesn't make sense, but that's the reality. So, this is Patrick here. We were shopping early on, and this is obviously Luba and Theresa and the rest of the crew, which so many of you know. So thank you all. Go through some questions, but don't hesitate to feel free to leave. Dr. Zillian.
Testing? Yes. Tim, I'm curious about the international response. Other than Great Americans from Tiverton, I heard Germany, I heard Italy, I heard Doctors Without Borders, Catholic Relief Services. Were there any non-Westerners there, either individuals or institutions or countries?
Yeah, so first, a couple of thoughts. The first is, from the Catholic Church point of view, people talk about, missionaries and groups. We always imagine those are Europeans or Americans. Most of those people are other Africans coming to work in West Africa, other Asians coming to work there. The church is so international in that regard. Now, what about other groups? I'll tell you about some heroes and some not such non-heroes. The heroes in my book are the CDC. The Centers for Disease Control, even though they got a bad rap here, they were present on the ground from the very beginning. And Tom Frieden, the head of the CDC, went to Liberia in August, early on. He was out there ahead of his boss. Before the White House was engaged, he went and he spoke and was really present. And that, you don't always want to be out there ahead of your boss. And he did take a little grief for it. But they were really present and doing phenomenal work. On the other hand, the Department of Defense is totally prepared for Ebola because they see it as a bioterrorist weapon, or it could be involved in warfare. So they have all the capability and know-how to deal with this class of organisms. They call it viral hemorrhagic fevers, but they were not showing up. So it's like, what's going on? And I have a buddy of mine in the Henry Jackson Foundation where they do a lot of this work. So what's going on? He said, we want to go, but we can't get the green light from the White House. So then he said, we're going to get it this weekend. And that weekend, President Obama came out on Meet the Press and said, we're going to help in Liberia. We're going to go. And particularly Liberia because the U.S. had been involved in Liberia for so long. Then the next Monday, the Pentagon spokesman said, we're going to build a 25-bed hospital that's going to help there, particularly for NGO, non-governmental organization workers, and that'll make all the difference. We're like, what? 25-bed hospital? This is ridiculous. So then there was a big outcry and a lot of squawking, and then the Department of Defense kicked in big time, and they made a huge difference. But they were late. WHO was late. UNAIDS, UN, late, and same with even our NIH. You know, the head of the infectious disease group at the National Institutes of Health, Tony Fauci, you know, why weren't you working on these therapies in March and April as opposed to waiting until August? What a difference that would have made. So there's a lot of delay, which was really too bad.
Sorry. The Chinese there or the Russians?
Yeah, so the Russians, no way. It was very funny because there are lots of Chinese restaurants all over Liberia because the Chinese are everywhere, and they all bolted in July. They left town, and all the Chinese restaurants closed. Then, it was quite funny, then the Chinese came back and they built an Ebola treatment unit, and then the Cubans came back to staff one of the units. So they were, different groups were around to different degrees and different levels. Yes?
We have obviously a big problem here with infection, particularly in the hospitals of CF and MRSA. Have we learned anything from this crisis in Africa to help with the infection problem?
Yeah, I think the CDC did learn. One of the things they learned was you've got to establish centers of excellence. So early on they said, everybody train up, know how to deal with Ebola, that's good enough. And then the incident in Texas occurred where and it's public knowledge, so we can use Mr. Duncan's name. Sad that he died. He went to the hospital. He just flew back from Liberia, went to the hospital, and he had a fever. And they said, well, when you go home, it's probably just a viral illness, which it was. And then obviously he went back. They recognized it was Ebola. He got sicker and sicker. Two of the nurses became infected. And what that showed was when you're dealing with a lot of really bad infectious agents, you've got to set up centers of excellence. So now, if there's a case of Ebola, the CDC sends people to watch over everything that's being done. And there are 4 centers set up specifically to take care of people with Ebola. So you know, the expertise needed for some of these infections is at a level that not everybody is ready for. So to give an example, in Boston, you know, there must be 25 hospitals in Boston. Does it make sense for every single one of them to be Ebola prepared?